when you're speaking. I hope the translations will be compatible with what I want to share. Looking at the German-Turkish perspective on the medical systems, I'm sharing my experiences of the last 2 years when I'm working out on integrated and personalized therapy, which is on predictive, preventive and personalized medicine as what we are looking at the common practices to start and center of integrated medicine at Tesla, where we will have predictive diagnostics with molecular biology and preventive and personalized medicine with traditional therapies. And we are also looking at the predictive diagnostics with ethnicity and the DNA mapping. So this is where the whole system of the cross culture is coming up. It depends completely on the main healthcare status, that's the healthcare resources, lifestyle factors which have diet, alcohol, tobacco consumption, socio-economic environment, income, education and pollution. As we are looking at this map, when we look at what we combine with the German population or the Turkish population living in Germany, and what is the concept of preventive and personalized therapy? It all depends, these were the factors which we shortlisted for the predictive diagnostics. And then depending upon how the lifestyle changes, when we look at the lung cancer, the breast cancer, fracture of the femur, occupancy, turnover, cataract, post-consultation doctors, measles, influenza, asthma, bronchitis, amendable mortality and heart failure. This is all coming up with the lifestyle they are living in. With the German populations, when we had the predictive diagnostics, they were more into breast cancer and lung cancer because of the smoking. And the Turkish populations, it reduced down. And fracture of femur was more in the Turkish women, the older women, because of the weight, and the occupancy and the cataract. These were the determinant factors of predictive diagnostics. It takes about 2 hours to just explain the whole thing. I'm just giving a brief of it. Then again, the challenges what we had was the population covered, depth of coverage, insurance, patient choice among the providers. This was the major challenge what we faced. That was patient's choice among the providers. Germany is completely under the insurance, and the Turkish population have no choice but to go to a male gynecologist because of the insurance coverage, and they don't want to go. This was the first concept which we found that they don't, even though they get it covered, but they are constrained to go to a male gynecologist. So this was the first priority on the patient choice and the health-seeking behavior trend. The health-seeking behavior trend, they have to go for the private insurance and the other insurance. And the private patients, like if they have to pay privately 50, 80 or 100 euros, they don't prefer to go. And then when you look at the degree of decentralization, how they are accepted, like the consultations. If they're going, they're not able to explain, even though they know German, but they're not able to explain the pretext. They're not able to explain and communicate with the doctors. That's what I was speaking about, the healthcare system. They are used in Turkey for non-gatekeeping and ample choice of providers for users. That is, like they have the ample choice. They can go to a private doctor, they can go to a public hospital, they can go to a private hospital. When they come to Germany, it's completely insurance covered. And now it comes to the ethnicity. The complete ethnicity, they are Turkish, but living in Germany, the whole constitution changes. The variance belongs along with the tradition and the culture, and which directly influences with the diet. The food behavior of eating, cooking, herbs, and the aging. Here we have the concept of the halal and the non-halal food. That's where the complete health, the holistic health is depending upon. The drinking, even they are Turkish, but they also abstain to drinking, and some of them are also drinking, and their whole diet concept is changing. conditions, but they are not able to adapt. The older women still keep in the pretext. For certain conditions, like they go to one doctor for the complete antenatal care checkup, but they have to go to another doctor for their labor. This completely affects the psychological status and the mental status of the people there. Here, when they are going to the antenatal checkup, they are going to the same doctor for the labor. But most of the Turkish population are facing this in Germany because the women go to the antenatal checkup to one doctor and then they have to deliver to another doctor. The complete system changes. And there again the cultural, the cultural and traditional pretext depends upon. And this is going directly to the psychosomatic disorders during pregnancy, which alters the complete system of the whole body structure. I mean, the whole complete system changes. It affects even the fetal development. It also affects even the mother's psychological status. And now, how it is the prevention? When we are talking about the prevention, we have to have separate groups of workshops. We are separating with the Turkish population and we are separating with the German population. When we say prevention, you have to have these kind of practices, like the breathing practices. Then we speak about praying in the prevention and the breathing exercises. We also have the Indian medicine, the yoga system, which we cannot put into the Turkish religious system. They have fatwas saying that yoga is banned among the Muslim populations, and the Ayurvedic herbs which are prepared and the formulations prepared in cow's urine, the halal and the haram concept. When you say that, okay, using this herb and this formulation prevents, these are the preventive measures. We need to do the prevention. And when we look at the lifestyle, about the food and the conditions, what they are taking in their diet every day, the German women are more prone to liver disorders because of the high fat content they take. And they are more prone, and whereas the German women are more prone to irritable bowel syndrome, the intestinal disorders. So we cannot make a biomarker for the prevention of certain taking. Okay, now the German and the Turkish mix, because they are living, the younger generation, especially the teenage girls, they are having a mixed lifestyle. They are having cross-culture variants. The father is a German and the mother is a Turkish. Mother is a German, father is a Turkish. So here the diet is mixed, the lifestyle is mixed, and here we are facing the challenge of how to give a health education for them in the prevention and the diet lifestyle. These were the challenges. Environmental, occupational, socio-economic stress. Environmental changes. Most of them are not able to adapt to the environmental changes. Occupational changes, like when they go to work, because of wearing the hijab, they are not able to get the job, or even when they are walking, even a glare at them goes into a psychosomatic disorder. So some of them come out and say, we have a burnout. For 3 years they don't have a job. They don't get their university placements. But they cannot speak about this. They have to go to a psychologist or a psychosomatic. And that's where they are coming to traditional healers. They are saying, I'm nervous, I'm feeling like there is a black magic. I'm feeling like there is, they have the lack of confidence in them. And the socio-economic stress, they are migrants, most of them, and they have the stress of their economic conditions. Like they are not working most of their time because they are not able to work. That's where we are going on the personal implications and putting up the mind mapping, asking them to relax. Then we have stress management, then lifestyle changes and positive thinking. We are trying to, even though the cross-culture variations, with these factors, we are getting the psychologist where we have blood samples of 52 teenage girls from the Turkish population between the age of 13 to 17. And when we did this DNA analysis of predictive diagnosis, we found that they are prone to have fibroids because of the stressful condition after 4 years. This was just because of the conditions. They are not able to adapt with their colleagues. They have the palpitation, they have the nervousness, cold feet, and these were the physical conditions. But when you look, this is also affecting into their hormonal islam.de, you can just put on, it's a group where we are working out on holistic prevention, bringing in the religious counseling, diet, nutrition, lifestyle. We are trying to give health educations to adapt, to accept their ethnicity first, and then to accept that we have to live into this environment, and these are the conditions to adapt, not to fight within them, among themselves. Like they have to fight every day. Okay, today if I'm going to wear a scarf, I may not get this, but this is something which is psychosomatic and psychological, and most of us not accepted. That's why the European Medical Association is bringing out a project on, called as IMA Global Project. And here we are working out the cross-cultural variances of German, Turkish and other migrants. One of the projects is the German-Turkish implications on protective preventive along with we will be starting the centers, and they will be collaborating with the mosques for the Turkish population. That's why we are looking at integrated medicine. We would like to integrate the predictive, the modern medicine